Begin, we should remind you that in 1971, with the creation of the Polito Convention, the governments of Bolivia, Colombia, Ecuador, Peru, and Venezuela gathered with a sense of solidarity in the region to create a bridge for peace in health and to work towards general well-being. So today, the Andean Health Organism of Polito and Nanue has this important and constant work with the Ministry of Health of the six Andean countries to materialize the right to health. In the middle of a technical evolution, the COVID-19 reaffirmed the need for the health sector to improve well-being. This is why this is now a priority to maintain health in the center of policies and the social consciousness of our society in order to move forward. Health is the bridge for integration and for peace. Without the right to health, we have no right to life. So thoughts such as these and different information from the actions that we take is something that you can find in the Andean News Bulletin in its monthly edition, and we invite you to find it on the webpage of the Andean Health Integration. We invite you to state your name, your organization, and your country in our chat in Facebook Live and YouTube Live. You can also send your questions in the chat or via email. To access your certificate of attendance in any of the Facebook Live or YouTube Live chats, you will find a fixed link where you will have to fill out a short poll. Please verify that your email is written correctly to send you the certificate. This certificate will be sent in the next few weeks to your email. In this webinar, we will have the following dynamic. We will begin with our institutional greetings. We will move on to our master talks to then have a dialogue based on these questions and all the different platforms. So to begin this very important day, I will give the floor to Maria Carmen del Calle, Executive Secretary of the Andean Health Association, so she can give us our institutional greeting. Go ahead, Maria. Thank you so much. Well, good morning, good afternoon, good evening, based on wherever you are and where you're hailing from. On behalf of the Andean Health Organisms, Polito Enano Orascono, I am pleased to cordially welcome you to this very important webinar called Digital Prevention in Health, Best Practices from the Nordic and European Experience, which takes place and has been organized together with the Copenhagen Institute for Future Studies. This year, we will celebrate 5 consecutive years of webinars, which is an initiative that was created as a response to the need to maintain the exchange of knowledges in these challenging times and has consolidated itself as a permanent space of learning and technical cooperation. The issue at hand is especially relevant for our region. Digital transformation in health constitutes one of the fundamental pillars to strengthen sanitation systems in our countries. Through our work group of digital health, Orascono has been promoting the exchange of experiences and best practices which allow and strengthen technologies to improve access and quality of health services. The Northern European experiences and Nordic experience represent an important learning opportunity in digital health for our region, especially when it comes the development of innovative strategies that promote learning in health and the empowering of our organizations. Today, we have the honor of having two distinguished international experts. Dr. Christine Sorensen, who is the founder and director of the Global Academy of Health Education, who has dedicated her career to strengthening the capacities of people to access, understand, and use information in health. Her trajectory and international recognition are testimony to her valuable contribution. And Mr. Joe Max Wacking, who has over 26 years of experience in health system technologies and digital transformation, who will contribute his vast experience in the implementation of technological solutions, innovative technical solutions, to improve the results. I am sure that your presentations will provide valuable elements to continue moving forward in development and the implementation of digital health strategies in our Andean region. I sincerely thank the Copenhagen Institute for Future for their collaboration in the organization of this event, as well as all of you for your participation, especially the work group from digital health of the Andean Organism of Health, the Paul Hipólito Unanue Convention that has been making very important steps in this topic. I invite you to make the most out of this exchange space, write questions, and share your ideas that will enrich our discussion. Welcome, everyone. Thank you so much, dear Dr. Kai. And to continue with the institutional greetings, I will give the floor to Dr. Boje Eliasson, Chief of Movement Health and representative of Institute of Copenhagen for Future Studies. Go ahead, Dr. Eliasson. Thank you so much for organizing today's webinar. Currently, I'm in my homeland, the Faroe Islands, which are about as far as you can get from Peru. Well, there are small islands wedged between Norway and Iceland. And today's topic was actually how can we work with greater precision with genomics, but also digital tools. So it is quite appropriate to connect on this topic. And with great pride also, we have with us today two great friends, but also two very professional collaborators that I respect a lot. Christina Sorensen is a leader in health literacy, in how to use tools with wisdom for health professionals, but also for the citizen. And Joe Max Wacking has been my co-worker, co-director in the Institute for Future Studies. In the last 2 years, we have worked on many projects together, and with these two, I think you are going to hear, you're going to feel the impact on how to work with people and how to use technology. And once again, I am very happy. And as usual, I thank you for the collaboration that we have had and we're going to continue having in the future. Thank you so much. Thank you, Dr. Eliasson. Then after the institutional greetings, I will introduce myself. My name is Yadira Salas. I am the technical operator and the coordinator for the digital health group for the Andean Health Organism, and with great pleasure, I will moderate this webinar. So let's begin this space for dissertations. So for this, we cordially welcome Christine Sorensen, who is the founder and director of the Global Academy of Digital Health Literacy. She has studied medicine and public health and global health. She has advised WHO, the European Union, SDC, the European Parliament. Christine Sorensen has, again, a global health literacy project that has won an award in 2010 for its participation and has a social impact. In 2017, she received the International Award in Health Literacy because of the global impact, and in 2018, the Asian Prize for Health Literacy. Christine Sorens is the first president of the International Association for Health Literacy and the executive president of the European Health Literacy Council. She is an advising member in several health associations in Asia and Taiwan, for Bridge for Health in Canada, Health Diversity for Children in Germany, and the European Health Fisher Forum. Go ahead, Christine. Welcome. You have the floor.
Thank you very much, and also for the very kind introduction. I'm so pleased to be here. Bon dia. I'm calling in from Denmark. As I said, I've spent some time in Mexico. I've been to Brazil, but unfortunately, and Colombia, but not yet to Peru. I do hope I will have a chance to visit more countries in South America. So the invitation today is to talk about digital health literacy and prevention as foundations for inclusive digital health. And we all strive to have health, wealth, and happiness. And living in Denmark, it's called one of the most happy nations in the world. We are fortunate to have a high level of welfare and safety and so on compared to many other countries. But still, also in Denmark, other Nordic countries, we still also struggle with some barriers to health systems and also some disadvantage or people in disadvantaged situations. Because, as you all know, we live in a world under pressure. We have climate change. We are faced with burden of diseases, some of them communicable diseases like COVID-19, tuberculosis, and others, and the non-communicable diseases where the burden of cancer, diabetes, cardiovascular diseases are taking its toll. We have had a shortage of staff, many different places, and both in primary care and secondary care in communities. We've been faced, with the worldwide COVID pandemic. We also see that many are struggling with mental health, and a lot of it is also grounded in the unrest that we see currently due to not only natural disasters, but also human conflicts and political unrest. So we're trying to live in a world where we have to deal with both personal issues, national issues, and world issues at the same time, because we live in a digital world. So nobody can hide. We all confronted with all the happenings around us. Health in itself is not a human right, but access to health is a human right. And to really fulfill that obligation, we need digital systems that apply to everyone. We need also a sound health infrastructure that helps everybody to get the access to health that they're actually entitled to. But we also need people to keep themselves healthy. And when I talk about equity in health, and I also want to link it to digital equity in health. And to me, digital equity in health means that everyone has fair and equal opportunities to benefit from digital technologies that support health and well-being, regardless of factors like income, education, age, language, geography, or ability. So equity and digital equity in health really means that everyone has the access to technology that is needed for them to be active participants in society, also the digital society. That means internet, devices, and platforms. So perhaps we should talk about access to internet being a human right, because it's jeopardized. You are jeopardized if you can't access information on online information. We also talk about digital health literacy, which I will be diving into now. So how do we empower people to make informed decisions and share decisions about their health, and also about strengthening their community's health through digital health literacy, and that we ensure that it's cultural and linguistically appropriate. I know you also live in countries where there are many languages, and it's always a challenge to make sure that every sort of population will fully be able to understand and access information in ways that are appropriate to them. And therefore, we also encourage accessible and inclusive design, also of digital devices and different digital infrastructures. So talking about health literacy and digital health literacy is always two-sided. It's like one coin where you have two sides. One is on the personal level, the other side of the coin is the systemic level. So let me just briefly explain to you what I mean about what health literacy is. So general health literacy, it's linked to literacy. And in South America, you have also a high tradition for focusing on literacy. So the two things are not necessarily the same, but they are cousins, not twins, as somebody said to me. They are part of the same family here. It entails the knowledge, motivation, and competencies to access, understand, appraise, and apply information in everyday life. When you're ill, and so in terms of healthcare, but also prevention, as we're talking about today, and health promotion. So when you try to keep yourself healthy. And health is not an end goal in itself. It's about maintaining and promoting quality of life during the life course. This is why I also started by highlighting happiness and fulfillment and being able to flourish in the beginning. As I mentioned, it can be seen from two sides. On one hand, the individual perspective on health literacy and digital health literacy, but also from a systemic point of view. And we define organizational health literacy as an organization-wide effort to make it easier for people to navigate, understand, and use information and services to take care of their health. And that is also applied to the digital sphere. How can we, working in healthcare systems, in prevention, make it easier for people to maintain and promote their health? So taking that to the digital sphere means that digital health literacy is the ability to find, understand, evaluate, and use it, digital information to take decisions for themselves and for others. And we know it has a strong impact from our research. This is a model we developed some years ago on general health literacy, but it applies also to the digital sphere. So you see at the core here that it's about finding, understanding, and judging and using information to take decisions in healthcare, prevention, and promotion. On the top, you can see it develops over the lifetime. It makes a lot of sense. We acquire knowledge, we practice our skills, and therefore we change our competencies during the life course, also when we have different life events happening to us. To the left-hand side, you see how it's influenced by personal factors, so age and personal characteristics, educational level, and situational determinants where you live, work, love, play, shop, so forth, and the wider societal and environmental determinants, which means basically also those systems that we are part of, which differs from country to country. And to the right-hand side, you see clearly how it has an impact on health service use. So also the health cost and health behavior and behavioral change, and therefore also the health status of people, the health outcomes, and how people engaged in systems and how they're empowered to act. And then it's closely linked to social determinants of health and equity and sustainability, where we see, unfortunately, a strong social gradient. So those that are less educated, have less socioeconomic status, they also are often faced with health literacy challenges. So enough about definitions and models, but this was just to give you an idea of what is it that health literacy is about and what kind of impact does it have. We know from research that it increases better health outcomes, better economic outcomes, better user satisfaction, but also better staff performance when people are health literate and digital health literate. So it helps saving lives, costs, and time. And this is the short version from our American colleagues. So it shouldn't be neglected. And even though it's a term that many don't know yet or know how to apply, it's still important. We have just measured digital health literacy in the European region, and this is an article that was launched here in March. And we have seen, unfortunately, this very strong gradients of those that are less advantaged also have challenges with the digital health literacy across the 13 European countries. Unfortunately, we don't have this kind of data yet from other regions like South America or Africa, but there are several also country studies that still support these findings. So what it tells us is that there are gaps in our buckets. If we think of systems and digital health systems as a bucket, we are full of good intentions. We fill in a lot of resources to make it work, but there are still some gaps that needs to be considered. I think of it like the adventures of Goldilocks. Maybe you know the story about Goldilocks who comes into the house of three bears. She tries the chairs, but one is too big, one is too small, and the last one she can sit on. She tries to eat the food. One bowl of porridge is too hot, another one is too cold, and the last one is the good one. And she goes upstairs and she tries the big bed, and it's too hard, and the other one is too soft, and then she falls asleep in the last bed, which is perfect. And then she wakes up when the bears come home. So making that magic fit of everything being the best solution is what we try to aim for. Why is it that our citizens or consumers should, or patients should try every chair, every bed, every part before they find the right one? The big catch is here. How can we design systems that are really making that perfect match from the beginning? I'll give you 3 examples from Europe. They are 3 European studies, or sorry, not studies, projects with support from the European Union, European Commission. The first one here is called IDEAL, Improving Digital Empowerment for Active, Healthy Living. It was a research project where they have been mapping digital health in the European region. They've launched a website where they promote like a digital health atlas. I don't have the link here, but I can share it. And it gives an interesting overview of what type of projects are countries in Europe doing. They have also made a map on the gaps and challenges in healthcare systems on how we can improve digital health. The IC Health project, Improving Digital Health Literacy in Europe, was a series of MOOCs, so Mass Open Communication courses, and these are available still, as I'm informed, for professionals to improve their digital health literacy skills. So instead of blaming citizens and trying to improve the skills of our citizen and populations, the idea is that we start with ourselves and improve our skills at a professional level. The Skills for Health Literacy project I've been part of for the last 3 years. We are now just wrapping up the results. It was also funded by the European Union. And in this case, we are focusing on the area of dementia care. And we have been piloting digital courses for health professionals and health and care workers and students related to university colleges in the Nordic countries, so Norway, Sweden, Finland, and Denmark, not Iceland. And we've tried MOOCs as well as using digital platforms and digital services in the courses. And they were received with big success from many of the students, because they see how we can improve those skills, and especially improving the health literacy skills and make it easier for them to explain difficult health issues to their patients, but also the families and caregivers. to enhance the quality of our care and prevention. So it also focused on people living at risk of dementia. So the prevention strategies was included in this project. So if we are to design new systems, including digital health literacy and health literacy, this is a model we developed with the World Health Organization a few years ago, and I'll just briefly take you through it because I think it provides us with questions we can ask ourselves when we try to implement health literacy and digital health literacy. It has 8 strategies or 8 areas of action, sorry. And one of them is digital health literacy leadership. Imagine you're the captain on the ship and you're the ones to set the directions, and too many captains don't know about health literacy and digital health literacy, but now you do. So think about your organization, wherever you work. It starts with you. What's your motivation? Why is it that we want to make it easier for people to find, understand, and use information to take decisions? What can we do? What can you do? And have it as part of your mission and vision. And then it is about the people that we try to serve. What are their challenges? What are their demands? It's like Goldilocks, how could we best help Goldilocks here? Who do we serve? How are they engaged in health matters? What are their success and challenges and concerns? So talking about the digital world, what is it? Is it that they can't afford the devices or the smartphones, for example, or is it that they don't know how to download the apps, or is it that they don't know the information? Is it that we make too difficult websites to understand? Where are the challenges and concerns, and how can we then address it? Because if we have the data available, whether it's qualitative data or quantitative data, then we can start to design the strategies and make targeted interventions. So look at your organization. Where do you retrieve data? Do you need to make a specific digital health literacy survey, or can you use some of the data that you have already available? And then it's about improving it, implementing it at organizational level. So we had the coin here. We've looked at the personal health literacy and personal digital health literacy. Now we need to look at it at organizational level. So your organization, does it have a health literacy or digital health literacy strategy? What are the gaps? Where do we need to strengthen the efforts? Is there any staff we need to train? Are there the resources available? What's the common goal? How can we create a culture of health within the organization? And indeed, here comes the health literate workforce. We need to get our colleagues engaged in this agenda to make more inclusive offers and services. We think we do well. Remember the bucket. We have the bucket. We're pulling in resources, and we actually think we have a bucket that is all full, but it does have gaps, and these are the gaps we need to identify as quickly as possible, and we need our colleagues to be skilled enough to actually find those gaps. And that creates also the opportunity to have partners. This is a great way, like our webinar today, where we work together to create and share knowledge with each other to see where can we learn. I hear a lot of concerns about that we are trying to reinvent the wheel every time, but actually we can learn from each other and build on each other's experiences and start at a higher level before we scale. So again, what are you working with to promote digital health literacy, and how can you share that? I think some of the things we do in Europe, we could apply to a Latin American setting, but there might also be a lot that you can teach us in other regions. So let's try to make it an equal partnership. Lastly, it's about health literacy, innovation, and technologies, which is really about the digital schemes here. And how can we make it as user-friendly as possible? How can we avoid also the spreading of mis and disinformation, because we all have a responsibility in that. It requires investments in resources, but we should make it work. These are the 8 strategies on one slide. You are welcome to also download this book. It's called the International Handbook of Health Literacy, which is written by hundreds of colleagues from around the world, and I can send the link now in the chat. To finish off here, for me, health literacy is really like Formula One. It takes such a driven team to make sure that the one driver can drive his car to win the race. And we all have a play in that, whether we are the engineers, whether we're the coach, whether we are the driver. Nobody can do it alone. We need each other's support. And you are the champions. You are the ones that can make this change happen so that we get this digital equity that we're striving for. Thank you so much for your attention.
Muchísimas gracias, estimada Christine.
Thank you so much, dear Christine. That was a wonderful presentation with an important framework on health equity and, of course, sharing some denominations that have been handled in many webinars, such as digital literacy, access to digital health, content that is appropriate, linguistically inclusive design, and results that are particularly valuable for our Indian region is understanding how this European experience has helped empower these coordinations in digital health literacy, and these three models that you have presented in terms of how making the health information understandable, accessible, and applicable to all the health professionals is a significant experience that, without a doubt, we have to consider. On top of that, I can also point out that Christine's explanation on how health literacy can reduce inequalities and access to health services is particularly relevant. And this is because in our region, we face big technological and educational gaps. So these specific examples of success cases in European and Nordic countries invites us to adapt them to our socio-cultural context to continue exchanging experiences in these types of webinars. So thank you so much, dear Christine. We ask you to stay in the room to receive further congratulations and comments, and some maybe very interesting questions that surely will be asked as part of this dialogue, as part of the Q&A in our chat. And now, we give a cordial welcome to Joe Max Wackim, who is a Vice Director of the Copenhagen Institute for Future Studies for Health. He has over 26 years of experience in health technologies, strategic development, digital transformation and management, and he studied to be a biomedical engineer in health information. And in University of Wales, he has worked in the intersection of health and technology, promoting innovative solutions to improve results in health. Before he was part of CIFS, he was a director in information technology in the Urdu American University, leading information in hospital systems and health information. He also participated in executive group of electronic record in Public Health Committee, in the National Public Health Committee for private hospitals. Additionally, he has taught courses on information systems in health, health informatics, and evaluation of health technologies in the Science Faculty of Health. So welcome, dear Joe Max. You have the floor. Go ahead, please.
Thank you very much. Thank you for the invitation. It's an absolute pleasure to be here. I've never been yet to Latin America altogether. I'm based in Switzerland. I've traveled quite a bit, but I've yet to visit. So I hope one day I will be able to come over and visit. So I will share some of the experiences, but I will also share some numbers that will help us understand why it's so important to move towards prevention. First, just a few words about the Institute. It was founded in '69 by a former OECD Secretary General, and we essentially help organizations and Ministries of Health and others to imagine, work with, and shape the futures, try to transform towards a better future. So we often say that the future is already here, and but it's not evenly distributed because different countries work at different paces, have different knowledge. And as Christine said, I'm sure there's a lot that Europe can learn from Latin America, and you can learn from Europe and other parts of the world. I think we underestimate how much we can learn from each other to improve health globally. So why do we need to think differently in health? The challenge is that so far in the past, we've been basically too focused on treatment rather than on prevention. And in certain places in the world, this has created a burning platform because we essentially end up spending a lot of money on people who are sick much later in life. As you can see from this chart from a study that was done in Denmark, all expenses in health are done later in life, which means they're much higher because people get sicker. And we know for a fact that if we spend more time and energy and money on making sure that people stay healthy, then it also reduces the burden on the system. And this is, based on the studies, it is proven that it is possible. This other chart shows the difference between prevention and treatment. 70% of health benefits comes from reducing the environmental and social factors that surround us every day. We only get 30% of the benefits from the healthcare system, from the treatment. So it's logical that we spend more time on trying to stay healthy and making sure that the environment we live in is conducive to improving our health. And this is some more numbers that shows how, for instance, these are from Europe. It shows that 83% of chronic diseases, there's going to be more chronic diseases in Europe by 2030, 83% increase. And as well as an increase in hospital admissions that are preventable. So if we focus more on prevention and different ways of preventing and staying healthy, staying active, we not only improve our health, live longer and in a healthier way, but we also improve our economy, our community. This highlights the importance of transformation, of the need for transformation, not only because of these numbers, but it's also because of the projected shortages also in the number of healthcare professionals that are treating, that are there to help, in the treatment part of things. And I like very much Christine's presentation on digital literacy because as technology evolves, and I'll be talking about some of the tools, we can actually empower our ability to improve our lives with different tools. This is another number that is actually alarming, that shows why it's important to shift to prevention. In Europe, 700 billion euros are spent annually on preventable chronic diseases. These are things. So if we do things right, we should be able to reduce that burden. So the new focus areas when it comes to health is really, these are the things that we promote as part of the research that we do through the Institute, is we need to focus on well-being over lifespan, making sure that we stay healthy as long as possible, and make sure that we are patient-centered, or make sure that individuals, whether they're at home or in the treatment, in the healthcare system, devices, solutions are patient-centered, they're human-centered, they're easy to use, they're conducive to helping individuals engage in their own healthcare. It's also about value-based care with outcomes, making sure that care is focused on making sure you get the best outcomes. Obviously, we want to make sure that its access is made more equitable, across the board. We know that some technologies are not available everywhere, and so some things can be accessed. Technology has been evolving significantly, and we've seen that even though it may not be as accessible as it used to be, there are ways around this. Making sure it's also personalized, and more importantly, the focus should be on prevention. And we also see that the emergence of data. We collect a tremendous amount of data every day through different devices, through the healthcare systems, and unfortunately, in health, very little of that data is used. Actually, only 3% of data is actually used. So if that data is to be used, it could be the new soil. It could be the place from which we can actually derive new findings, new ways of doing things, and new ways of preventing different diseases. So let's look at some of the technologies. You probably are using some sort of AI chatbots in Latin America as well, GPT or other. What we've seen is that there's a tremendous acceleration in the use of different tools in regular day-to-day lives, but also in healthcare. And that's going to accelerate even more. Actually, over the last 2 to 3 years, we've made more advances than in the last 20 to 25 years previously because of this acceleration. But unfortunately, not all of these technologies are used. There's another fact that very few people know is that the technologies we're using in healthcare today are typically 10 years old, 10 to 15 years old. And the reason for that is that it takes that long to actually bring them to market. So the development cycle, making sure that the technology is absolutely proven to be good for individuals and that provide and does no harm. Okay, it takes about between 12 and sometimes up to 18 years, whether it's a drug, whether it's a machine, whether it's a medical device. So it takes a long time. So we are actually using old technology, but hopefully this cycle is going to accelerate with all the new technologies that are coming. In the Nordics and in Europe, one of the technologies that are now increasingly used is telehealth. Not only telehealth for remote consultations, but also telehealth monitoring. So monitoring of the individuals who are at home, who are doing well, not necessarily sick. But obviously, for those who are sick, who have chronic diseases, it's also important to make sure they're monitored in order to do an early detection of their possible degradation in health. So telehealth is frequently used. I live in Switzerland, and for instance, my insurer, if I'm sick or something is wrong, the first contact is not necessarily with my doctor. The first contact is with the telehealth service that decides whether or not I should go see a doctor. So that kind of accelerates access to physicians from wherever you are. And it also improves the ability for the health system to decide where is the best care for the individual. This has also been augmented with the capabilities that we see every day with our little, gadgets, wearable watches, phones, and others. Even Google and Apple and others have basically integrated into their devices the ability to capture vital information that actually can benefit the healthcare providers in helping individuals stay healthy. This is still underused, but you'll see that in the Nordics, it's being used much more. Not only that, those companies are actually testing these things on their own employees. So they're basically connecting their own employees and making sure that they collect data from those employees to try to keep them as healthy as possible. My health insurance here in Switzerland offered me to, if I share my daily activities with them, then they will reduce my medical insurance premium, because it helps them recalculate and see whether I'm staying healthy or not. There are other tools as well that are now being seen in homes where you can actually do real-time urine tests in order to detect different types of diseases, early detection. We're also seeing significant advances in vaccines that are treated, that not only, we saw that acceleration when there was COVID, but also in cancer and other spaces. When it comes to staying healthy and prevention, we're also seeing, this is part of a study that the Copenhagen Institute is part of. It's called Phase 5. It's about monitoring individuals who are being followed on a clinical trial. And this study is now onboarding its first few patients. It's been in the works for the last 2 years. This is where individuals who are part of clinical trials, so they're sick, but the idea is to continuously monitor them even beyond once the drug is on the market. They are monitored in order to see the effect of the drug on the individuals, and making sure that either their condition can possibly be maintained and it doesn't actually lead to secondary diseases. This is one of the fears that we have. Once we have a disease, then we're likely to develop a second one and a third one and more complications. With continuous monitoring, this can be, the chances of that can be reduced. If we look at Sweden, for instance, one of the things that has helped significantly is making sure that the population has access to a health portal where they get health education on what to do. They can also, it can also help them in their risk assessment. There are risk assessment tools that they can actually, questionnaires they answer, and it tells them, if they're likely to be they're at risk of certain diseases, and then they can go and see healthcare professionals. Data is also being collected from prescriptions are also now increasing because of monitoring of the individual's activities. Medical professionals are also likely to prescribe exercise, and because they're able to monitor the adherence to performing the exercises, is seeing an increase. And thanks to these monitoring, we're seeing reductions in certain types of diseases, for instance, 23% in cardiovascular diseases. In Finland, similarly, there are 3.3 million individuals connected to the platform. In Finland, they were able to collect data. Not every country is able to do that yet, but they're able to collect data from wearable devices into the national health record, which enriches that record significantly and allows the predictive systems that are now being developed on top of this data to identify individuals at risk. Tools are also helping with, identifying and screening people for possible mental health, anxiety issues. In the Nordics, unfortunately, this is more common than other places because of, the 6 months of darkness or low light conditions. But also predictive analytics are helping reduce type 2 diabetes. If we look at Denmark, for instance, there's also been the ability of using data to reduce admissions through remote monitoring. So when we say remote monitoring, it is prevention. It's about making sure that if you trust the system, you share your data, you're engaged in staying healthy, then you're able to provide information to the health system that can help you remotely. And this information can help your primary care teams, but also your tertiary care teams whenever needed. And some solutions are deployed across the board. Similarly, in Norway, just monitoring and predicting falls helps actually in the reduction of falls, as well as using now AI on existing tools, on existing data, to try to predict the chronic disease and prevention. So this is part of preventive. With access to the portal, individuals are alerted that they, based on their age, condition, family history, etc., they can actually get should pay attention to certain things and have certain screenings early on in order to prevent possible conditions before they happen. At the European level, you can also see that a lot of research and money is being allocated towards prevention. As was mentioned by Christine, there's a lot of initiatives, not only to work within each country, but also to work across borders on identifying ways of using prevention insights in order to do that. And there's a lot of funding and also part of a number of projects where we're trying to collect information from patients, individual patients, in order to help technology companies improve the usability of different technologies to help with prevention. So here are some more numbers. For instance, it is estimated that COPD exacerbations can be reduced with remote monitoring by 40%. We can improve the early detection and interventions towards mental health by 28%. AI-powered chronic diseases and prevention can also be more accurately performed. And compliance using different mobile applications, you can also help with the compliance to the treatments, which is important. And prevention, I mean, prevention is two things. It's not just for the healthy people to stay healthy, but it's also for those who have diseases not to develop what we call secondary diseases. So that's kind of secondary prevention, and making sure that data and these tools empower individuals to do so. And as we all know, I mean, it's all about, at the end of the day, it's all about behavior. And this is why digital literacy is so important, because these tools can actually help us change our behaviors. The behavior is one of the most difficult things that to change, but with these tools we can. This is one of the concepts that at Copenhagen Institute for Future Studies was developed a number of years ago, where we show that you know, we could have, if we collect all of the different information about individuals, the behavioral information, the biology, which is the health parameters, different social factors, different environmental factors, because as we said, a lot of the health comes from our environment rather than the health system. Then we can, if we're able to assemble all of this data, then we're able to get a more holistic view of a person and how they're doing, and through that information we can actually help prevent diseases or degradation in health more accurately. But that alone doesn't work, because it has to work with the rest of the system. And so we can have the individual data, but that data has to be able to flow, and so there needs to be good data governance across the continuum of care, across the different systems, different organizations, healthcare institutions. Data has to be able to flow to other organizations in order to bring in the right insights, in order to improve health. And it takes a while to build that, and many countries are far from being able to do this. But this is where we should all be heading towards that, and starting small and connecting bits of information, and then slowly building the ecosystem at the national or regional level is the way forward. So when it comes to the digital prevention framework, these are some of the areas that need to be focused on, that are enablers and conducive to improved prevention. One of them is risk identification, so using different predictive analytics and tools in order to identify risks early through screening, etc. Behavioral modifications, so using different digital tools to remind us to take the medication on time, to remind us to do exercise, to make better choices in our food and things like that. The early detection of possibly serious conditions, and then going towards healthcare professionals in order to address those early on before they happen. And the continuous monitoring, continuous collection of data in order to sustain a healthier environment. And again, this is where digital literacy is key in enabling all of that. So if we look at, treatment versus early intervention in a summary slide, it shows that the traditional methods that we all used to be in is very reactive. Once we are not feeling well, we used to go towards the healthcare. We only had sort of episodal visits, and data was collected during those visits. And unfortunately, it's usually not as accurate because it's when we're not well. It also consumes a lot of resources, and it's a higher cost. And the overall long-term outcome is poorer. While with prevention, we're proactive. It's all about doing things early on. It leads to better quality of life and better outcomes. It's lower costs, and it also can be more scalable with digital literacy. So the last slide we usually like to leave on is the question: what do you want as a community, as a society? Do you want the best health system? It's great to have a great health system, but isn't it more interesting to have the healthiest population and doing everything possible to try to maintain the population healthy, and in order to have a better economy and better community? Thank you very much.
Muchísimas gracias. Excelente
Thank you so
presentación
much.
y análisis.
Wonderful presentation and analysis, dear Jomax. The models that you have presented in the implementation of technological solutions that are innovative in the European, especially Nordic hospitals, are particularly relevant. Especially, this was an interesting analysis on how these digital prevention tools can be effectively integrated into the existing health system tools, as well as the practical considerations in infrastructure, interoperability, and necessary data protection. On top of that, it is important to highlight this pragmatic approach that invites us to conceive a health system that can use this 97 remaining data percentage that is, as you said, not being used, and that requires a lot of literacy and infrastructure investment, building capacities, analyzing data, policies, data governance, among many other things. Thank you so much, and likewise, we ask you to stay in the room because there are many congratulations and many questions for this very important conference. Before we move on to the dialogue space, I would like to thank everyone who connected from the Ministry of Health, the academia, different social organizations, from Argentina, Bolivia, Brazil, Colombia, Chile, Cuba, Ecuador, Denmark, Guatemala, Mexico, Panama, Paraguay, Peru, and Venezuela. Everyone who connected. We have received many messages and congratulations. Having said this, I will start this dialogue, and we will start from the questions left in the chat that are presented by the different participants of the platform. I would like to start with the same order as the speakers, and I will try to summarize a lot of the questions, which are quite interesting. And this first question is for Christine. In any case, if Jomax wants to add anything, you may do so. The question first goes to Christine. Based on your vast experience in the HLS project and your leadership roles, what do you think are the most effective strategies to improve digital health literacy that can be adapted successfully to the Andean countries' context, considering our cultural diversity and linguistic diversity?
Thank you for this nice question. Currently, I'm in a research project where we try to map health literacy, general health literacy across South America, and we hope to publish this article this year. And it turns out digital health literacy is also one of the topics already explored in your region. I often hear that nothing is going on, we don't know anything, but actually we see from our studies that there are hundreds of groups already looking into health literacy research and digital health literacy research. So we need to get that type of data available for more people. We need to also have data from those countries that are not yet as active. We know Brazil is doing a lot, Colombia some, but Uruguay, Paraguay, others. We need to have it on the agenda before action can take place. So starting discussions is just, so that's is what I see as most effective, is to start that discussion among your partners. What can we do to make digital health more accessible, more understandable, and break down the barriers? And that takes political action, and it takes that we all start to implement it in practice. We saw a lot of the numbers from our colleague here from Community Institute of Futures Studies, and so getting those numbers there help also policy action. So that's where the funding could go from a start. But then also a lot of professionals already know where are the barriers. So if we can start addressing them, that will be the best way.
If I may add as well, we know that the young
Adelante.
generation.
Go ahead.
We know that the young generation is particularly digital savvy. They like digital tools. They're online all the time. So working with the school system as well to help them make use of these tools in the right way, help them to understand the value of the tools they're using, and also maybe help with them try to monitor and engage with their parents and grandparents and showing them and teaching them up. So teaching upwards from the children upwards. The other way that we see also engagement is through incentives. So incentivizing the medical professionals to their patients, to nudge their patients to start looking at digital tools, to send them when they communicate with their patients, they communicate through digital tools, and everybody is now familiar with chatting. So through the different patient portals, this is easy to do. And slowly, I mean, these are just what we call hooks to get the digital literacy flowing, and then they get interested in more and more things that they can do.
Bien, muchísimas gracias por esta primera pregunta.
Thank you very much for answering this first question. These are very interesting conclusions and analysis, especially highlighting the dialogue and participation of other actors, and from the work and experience, which Dr. Akaye can also confirm here, this work with the caretakers, parents, among peers, and especially when it comes to closing this generational gap where the children can teach adults, is something that is already happening, where the children are teaching their grandparents. So this would work very well to support this digital literacy process, and it is part of the work, and it's basically everyone's commitments. I will read another question. Well, there is a whole bunch of questions. I am trying to summarize them. And this one goes for Joe, Max, but Christina, if you would also like to contribute, you're welcome to do so. And it goes like this. Can digital health reduce the carbon footprint of the health sector without exacerbating the environmental damage, and how we can prioritize the low consumption health services in limited resource environments? Can this reduce the carbon footprint in terms of device manufacturing? I will leave this question open for you.
Yeah, thank you for this very interesting question and very challenging question. So some studies were done to try to assess how digital can actually reduce. The first thing is is it reduces, if you use telehealth and you use remote monitoring, it actually reduces the need for people to use transportation in order to get to the different hospitals and in order to get to primary care and see their physician. So that's one way of looking at things. And in terms of manufacturing, that's trickier. I have not seen anything that shows that reducing studies that show that manufacturing medical devices increases or decreases the carbon footprint. But certainly, I think one of the things we are seeing as well, at least in the Nordics, is that the medical the hospitals incur or increase the carbon footprint, let's say, due to the waste they produce when they receive patients. Because every time a patient comes over to the hospital, you produce waste. You have gloves that the healthcare professionals have to wear. You have, bed sheets that need to be washed. You have, different supplies that are used that may need to be incinerated, and all of these things. So reducing the visits, in addition to reducing the carbon emissions from motor vehicles, reducing the visits also reduces the waste and the need for incineration and other things that also produce carbon.
I think from my side, it's important to highlight that we also talk about planetary health literacy, and planetary health literacy is about how we can help better health of people and the planet. And that is indeed about raising awareness, also about each other's choices and our choices. So when you speak about digital health, it's also about how many devices do we need? How often do we change our devices? What can we do ourselves to ensure that the carbon footprint is not being raised. I see a clear difference in, for example, traveling patterns. And now we have our webinar today. It's great that we can do it in this way, and none of us have to travel. On the other hand, we miss the human connections. If we've been together, if we had our coffee chats, if we've been, I'm very sure that we could benefit even more and also get ideas and be much more creative than it's possible to be in a webinar. So I think there are these channels that serve some purposes, but we should never forget the human factor to the digital side, and the human factor bringing in the art and the science, and for us to be creative on how we can improve conditions for those in need. So planetary health with literacy would support digital health and digital health literacy.
Así es. Interesantes reflexiones y
Very interesting thoughts. And what you just mentioned regarding human contact in the digital is very important. It's something that we've missed during the pandemic, and something that we have talked about in different Orascona meetings where we have worked through different platforms such as Zoom. But the human contact, after many years, has also favored these connections that we have created. So it's important to think about the carbon footprint and the climate change, because it's something that we have to consider for all these spaces that we mentioned, and telehealth is one of these spaces. I have another question, and I would like to ask you, for both of you to answer, and it's quite challenging. From your experience, the European northern countries, the question is, how can digital health be financed in economies oriented towards austerity? That's the challenge. If you like, Christine can start, and then Max will follow. Go ahead, please.
I think I'm not fully into the whole business case of it, but in many ways, digital health democratize health. If we look at from a positive perspective, we can bring a lot of new knowledge and access to knowledge to many more people so that they can start the health journey at home, especially when we talk about prevention, but also health promotion, staying healthy, and not only about the risk factors, but really also to keep yourself healthy and enhance your well-being. So there is a lot more knowledge available to people in an instant way. They can even do exercise, watch videos, YouTubes, and so on. So there are lots of digital communities where we can support each other, and also keep yourself healthy with digital means and the different devices and so on. The downside of it is, of course, the investments that has to be done into the new technologies, into access to internet, so the whole infrastructure, the whole setup of also data security. In Europe, we now have the whole rules of GDPR about personal data, which is very different in many other parts of the world. So I saw in India they were using, for example, WhatsApp to reach communities far away. And there was a doctor in a hospital. He used WhatsApp to detect the diseases, and then only on indication they had to travel into the hospital. So that was a nice way to do it. But in the Nordics, it wouldn't work because of data security. So when I explained this very easy to use, very simple way, it's affordable, everybody has it on their phone, could have it on their phone. Our colleagues here in the Nordics said, "Oh no, we can't do it because of data safety." You probably also know. So there, it always comes with some dilemmas, some paradoxes that we have to tackle in the best possible way. But I think it's here for good. It helps to connect the world. So even though I bring in the human factor, but it does help. It does help us to connect, to meet tonight, right? So we should build on the good and try to minimize the bad impact.
No, I totally agree with what Christine said, but the infrastructure is costly. Building the right infrastructure for with standards and interoperability is expensive. But the payback is that information becomes more easily available in order to make better decisions. For instance, in many countries where the systems are disconnected, there's no sharing of clinical data. If a person goes to multiple institutions, they have to repeat the tests, and that's costly on the system because, or they have to bring in the test on paper, or has to be a lot of effort has to be made to re-enter the information into the different systems. So the exchange of information reduces, once it's established, reduces costs significantly. Secondly, but most importantly, because we're on the topic of prevention, it's really the investment is in, as you saw in the chart that I shared at the beginning, most of the costs are because we basically take action too late. And so if we take action early, we should avoid all this burden. Avoid, as we keep people healthier, they're more active, they contribute to community, society, they need less help. And all of that at the moment is costly. And they live longer, more independently. So again, less costs. So making sure that the focus is on prevention and on longevity and active longevity, overall will reduce costs.
Así es, y siempre hablamos en diferentes espacios
Yes,
de
and
estas brechas tecnológicas que
talking
existen.
about different spaces, these existing technological gaps, and this important example that Christina shared about how WhatsApp and the use of this analog technology allows people to access health from remote locations with a basic phone. And as you have seen, the issues Latin America has with access to internet in remote areas still creates significant gaps that we have to close. Based on these challenges, I also have a question. How could cooperation be strengthened between Europe and the Andean region to develop joint initiatives of literacy, and how an organ such as Orascono, what kind of role would it play in such a collaboration? Maybe Christine can start, and then Joe Max, if you like. Go ahead, please.
I think it would be wonderful to collaborate much more and learn from you. Especially, I think we could learn in Europe, I say we, your Northern Europe, about community and the support that communities can do and families. I think in the northern part of Europe, we have individualized health, we have outsourced health because of our national health systems are funded by public funding, and that gives us also a high level of security and safety, but also sometimes the lack of responsibility because we think everything is taken care of. Whereas I think in your communities, in your countries, you need each other to have flourishing lives, no matter what conditions that we are facing. So I think we can learn a lot about what's the English word, persistency, kind of, to and the mental health also, and the focus on development. We know the whole area of prayer and how you have brought education to the public is very inspiring, especially when we talk about health literacy. So there are lots of things we could learn from you. And I guess the next step is to set up meetings with those organizations that would be interested in developing a common plan together. So we can do that after this webinar.
With
resilience, that was the word. You have resilience. I think we could learn from you about resilience.
I agree, and one of the things that I think would help, I mean, there's certainly a lot of things that Europe and the rest of the world can learn from Latin America and vice versa. And one of the things can help is unfortunately another digital solution, but it doesn't have to be a complex digital solution. It could be what I call a community library, a platform simple to access by everyone. Healthcare professionals. It can also have a patient sort of element to it, something for the children with gamification. But the idea is to have a platform where then shared knowledge from the Nordics, from Europe, from the rest of the world, and vice versa, from Latin America, can be placed on this platform in multiple languages, with the aim of basically improving literacy, but also sharing knowledge and best practices across countries and across borders.
Excelente, muchísimas gracias por estas ideas tan valiosas.
Excellent. Thank you for these valuable ideas. In fact, we now already have some work to be conducted with the Copenhagen Institute for Future Studies. We've been taking these small steps because the Andean region has been growing, but there are still many gaps to close. As Christine mentioned, with the bucket example, we keep pouring water, but there are holes, and so the water is pouring out. So this harsh example, but we are trying to close those holes. And I'm now going to give the word to Dr. Kaye, who I think will like this idea of making this knowledge available in several languages, which would be great to translate it to all the different practices. And I also want to highlight that exchanging ideas is something that is on our agenda, the joint learning, because the joint learning that Christine mentioned, we share experiences with you. You learn from us and from you, because each region has their own particularities. Each one is strengthened and each one has its own limitations. And based on these different messages and this enriching dialogue that we have had here, I would now like to ask you if you would like to leave us with one final message for the Andean region, or some final thoughts that you think might be interesting before we close the session. Maybe we can again start with Christine.
Thank you so much. I think this has been really fruitful and also given me lots of food for thought, bringing on ideas. We have some years ago established the International Health Literacy Association, and I was the president until last year. And I think that might also be a platform where many of you could seek more information, but also influence. And as said, we are publishing a study on Latin America this year, and I'm happy to share it as well with you so that you can use this to inform your work. I welcome everybody to contact me if there's any way I can support you. You can find me on LinkedIn, or you have the email address here through the organizers. It's been a really pleasure to meet everyone. Thank you so much.
Likewise, thank you so much for inviting me, and I'm happy to also help anybody who's interested. My final words would be, because I mean we're part of the future studies, is to look towards the future, is to think, how would you like your health system to be in the future? How would you like your community to be in the future? And not just the next year or the year after, but think 10 years ahead. How would you see your community in 10 years time? And then work with your community to see what you can do now in order to get to this better future. So try to imagine a better future and start working now towards that better future.
Muchísimas gracias, estimado Joe, Max y Christine.
Thank you very much, dear Joe, Max, and Christine, for your wonderful participations. We have received many congratulations from the social panels. We want to extend our gratitude, as well as our gratitude to all the participants from Orozcono and all the people who participated in this activity, which has been possible because of the commitment of the Andean collaboration. So to close out this very important webinar, we'll give the floor to Dr. Maria del Carmen Cay, who is the Executive Director of this organ. Go ahead, Maria del Carmen. Well, my first words are those of gratitude, both to Christine as well as Joe, Max. You have both shared very important information with us. We think that the future is something that is here already, but again, it is not divided in a uniform way. It's not the same everywhere, because when we talk about digital equality, we have to make sure that everything that is digital is within everybody's grasp, that everybody has opportunity to benefit from the digital aspect of things for their health and well-being, and that it should have nothing to do with their income, age, or education. And this is something very important that we have to remember. Likewise, we have to acknowledge that when we are talking about, we should talk not only about knowing on an individual level, the knowledge is on individual levels, but also professional level knowledge, and knowing that this framework of digital prevention has to come with risk identification, with identifying behaviors, with early intervention. But I thought that monitoring was a very good point. It's not just for risks, but also not just risk mitigation, but also monitoring, because we're talking about different levels of prevention, not just primary prevention. There is secondary prevention, and even tertiary prevention. I think this is very important. On the other hand, I liked the topic of humanome. I thought that was very interesting. And I also really liked that we can all learn from each other, but we also have to be clear that we invest a lot in treatment and very little in prevention. And we know that if we invest more in prevention, we will fare better. And the topic that I think is very important is the fact that, yes, we have many experiences that we can share, because I think the big question, and that Boji always asks, is what do we want? A better health system or a healthier population? And Harari also says this in his book. The 20th century is the century of the sick. The 21st century is the century of keeping people healthy. They're different things. It says so in one of his books, and I think that this is true. However, we cannot forget that there are people who are sick already, so we have to do our best to help them. I think that this literacy is very important, starting from schools, but the issue is literacy in health, because what our countries show us is that you can be a health professional, administrator, architect, engineer, but what you least know about is your health, and we know that health is a fundamental pillar. So if you don't know anything about it, you can't do anything. So that's an issue. On the other hand, the decisions are political and they are high level, because to be able to invest, will we say, without budget, there are no rights. Because if there's no money, there's no investment. It's unlikely that we'll achieve everything that we want to achieve. But Boji always says something else. He says, we have something in favor. Well, speak Spanish. In Europe, you take a train 50 minutes away, they are already speaking a different language that has nothing to do with yours. So we have that in our favor. And the other thing that Christine mentioned is resilience. Yes, we are low income, medium income countries, and we have also become resilient. But we also share this non-transmissible disease, which is a pandemic. We share the issue of mental health, which is a world emergency, and we know that without digital literacy and without the application of all the health technologies, we are not going to make any progress. I know that we will likely be at the top of the mortality list from all the different non-transmissible illnesses, and it is completely proven that these illnesses are preventable. So I think there's a lot of work ahead of us. Thank you so much. This is the first conversation. We will never lose touch. We'll continue our conversations, and we'll try to fulfill our objective as the Andean Health Organism. It is an organism of regional integration on a regional level, and its highest objective is to contribute to the health and well-being of over 160 million people in our countries, Bolivia, Chile, Ecuador, Peru, and Venezuela. Thank you so much. This has been truly I would say, engaging, motivating webinar. And we will see you next Thursday. No, next Tuesday, the 22nd. I'm going to see you at 5 p.m. to talk about how your decision makes a difference in immunizations for everyone. Because we know that drinking water and vaccines are the first two proven measures of health prevention. Thank you all once again so much for your presence. We will see you soon. Goodbye. Thank you, Yadira, and thank you everyone from Morascono, especially Yadira, who leads the work group for digital health, and everyone who makes it possible for us to reach this webinar number 275 without any interruptions. We'll see you soon, and thank you. Goodbye.